Okay, so we are going to go through chapter 23. This is all about allergic reactions. We'll talk about not only what an allergic reaction is, but also self-administered epinephrine and EMS-administered epinephrine. So what is an allergic reaction? It is an exaggerated response by a foreign substance in your body. So you can essentially be allergic to anything. The natural response when a foreign substance is introduced into the body is to have an immune response. An allergic reaction is an exaggerated immune response. An allergen is a substance that can cause an allergic reaction, and an allergen can be just about anything. Anaphylaxis or anaphylactic shock is a severe life-threatening allergic reaction. This is where we have blood vessels dilating rapidly, causing a drop in blood pressure or hypotension. Cells leak fluid into the interstitial spaces, which is not where that fluid should be. Those tissues kind of start to swell, including the tissues in the airway. So it's a bad deal. Causes of allergic reactions, it can be essentially anything. There are some really common ones out there, things like bees, nuts, seafood, those are really common ones, but certainly it can be from pretty much anything. Plants, medications, chemicals like soap or makeup can all be allergens. And if you weren't sure what a bee or lobster looked like, here's a wonderful picture. I don't know why that particular picture's in there, but latex allergy is a particular concern in EMS. Thankfully, they've kind of gone away from latex products, especially latex gloves, because allergies were starting to be such a big issue. Now we use it's called nitrile gloves. But if you are allergic or you develop an allergy to latex, just make sure that you are using equipment that no longer has latex in it. An allergic reaction does not occur for the first time. Words are hard tonight, guys. An allergic reaction does not occur the first time a patient encounters an allergen. On the first exposure, the immune system kind of forms some antibodies, and then on the second exposure is when those antibodies combine with the allergen and causes this huge release in histamines, which shows up as an allergic reaction, right? We get the hives and the swelling and such. There's a huge spectrum of allergic reactions, right? There's mild rashes all the way to these systemic massive reactions that cause facial swelling and swelling of the hands and feet and around the vocal cords and all of that, right? Urticaria is a medical term for hives. Hives are a big indicator that they are having an allergic reaction. Where those hives are at and how bad those hives are can be indicative of anaphylactic reactions. Bronchoconstriction happens with these allergic reactions that decreases movement in the lungs. It also has, allergic reactions also create some vasoconstriction as well, so constriction of those blood vessels. The exact course of an allergic reaction is pretty unpredictable. We as humans are all different, so how allergic reactions affect us is all kind of varied, right? Severe allergic reactions can happen immediately, but they can also be delayed up to 30 minutes or even more. So sometimes it can be hard to determine what's causing this allergic reaction. If it's been 30 or 45 minutes from the time that they, say, ate strawberries or something, it's hard to pinpoint that, hey, that salad that you ate had strawberries in it, so that must be what you were allergic to. Right? Mild allergic reactions can rapidly progress. So if it starts out as a mild reaction, it doesn't mean that it's going to stay that way. It can certainly progress into anaphylaxis. We should be closely monitoring any of these patients that have known allergens to make sure that they're not getting allergic reactions. So signs and symptoms, skin is something we definitely look at with this. Itching, hives, red skin, kind of flushing, swelling, warm, tingly feelings. This is an example of of an allergic reaction with the facial swelling. So you can tell he's swollen around his eyes. He's definitely got a rash going on here around his whole face, down his neck. It looks like it might be on his chest a little bit there as well. This is a bigger kind of urticaria that shows up. This is a big kind of splotchy hive. Um, yeah, so it can look different on different parts of the body as well. When it comes to the respiratory system, tightening in the throat or chest, cough, rapid, labored, or noisy breathing, hoarseness, muffled voice, loss of voice, stridor, wheezing are all signs of that allergic reaction. You can also have increased heart rate, decreased blood pressure. I feel like rambling through these, I kind of sound like one of those pharmaceutical commercials. Um, there's a lot that can happen with this, right? Big thing is that there is a spectrum. So if you're having an allergic reaction, you may or may not have all of these things. Maybe you only have one or two of these things. And it's how badly you react to the foreign substance that dictates how we treat it. Again, this is where common sense kind of comes into things, where that critical thinking comes into it. If you say, if you get bit by a bee, you might have one person that gets bit by a bee or stung by a bee. They get like a little raised welt. It's itchy. Maybe it swells a little bit around the area, but that's it. What do we need to do for those patients? As an EMR, there's not a whole lot we can do, right? Ice pack, say, I'm so sorry you were stung by a bee. That's about it. All right. We could certainly give oxygen if they're like panicking because of it. We can, give them some oxygen, try and calm them down, that sort of thing. But that's about it. It seems like every class I always get somebody that says, "Oh, we'll give them Benadryl." No. So yes and no. Yes, book answer, test answer, you cannot give it. Or no, I should say no, you cannot give it. Book answer, test answer. But you can, however, recommend it. And if it is prescribed to them, you can help administer it. But you cannot personally administer it without a prescription. Okay. Now, this is kind of where we get into the gray area of EMS. If you have a patient that has a mild reaction to something, they're at home, they've got Benadryl sitting on the table next to them, they haven't taken it yet, and they say, "Oh my gosh, should I take this?" Well, do you feel like you need to take it? It's an over-the-counter medication. Do you feel like it's appropriate for you to take it here? We recommend that you take the dose that's listed on the bottles. Usually there's directions on the back of medication bottles. Typically it's around 25 to 50 milligrams for Benadryl. And you kind of play that gray area a little bit. But you, as the provider, should not be administering it as an EMR. Signs and symptoms of shock associated with allergic reactions: altered mental status, flushed, dry, pale, clammy skin, nausea, vomiting, and changes in vital signs. So how do we tell the difference between an allergic reaction and anaphylaxis? Biggest thing here is anaphylaxis is a systemic reaction. So not only do you have rashes, but you also have swelling. Like I mentioned, that bee sting, if it's right in one isolated area, that's not a systemic reaction. A systemic reaction is going to involve several parts of the body, right? When do we treat anaphylaxis? Well, we treat anaphylaxis when there's respiratory distress or signs and symptoms of shock. So those signs and symptoms of shock were on this previous page here. When we're assessing these patients, of course, we're going to go through our medical assessment: BSI, scene safe, MOI, NOI, number of patients, additional resources, C-spine precautions, general impression, chief complaint, level of consciousness, airway, breathing, circulation. Determined transport, and then go into your secondary assessment. So asking about allergies, what was the patient exposed to, how was the patient exposed, signs and symptoms, progressions, all of those things, right? All the questions. When do we give the medication? Well, we're going to fix as we find. And sometimes the fix for a problem is a medication. So if we're up in our airway and we ask ourselves the airway questions: is it open and will it stay open? And the answer is no, it is open, but it's not going to stay that way because they've got airway swelling. How do we fix that? Well, we administer the medication. We give epinephrine, the appropriate dose for that patient, or we assist with their auto injector. Now, is it going to stay open? Probably. Epinephrine works pretty darn fast, so usually the results are pretty quick. From there, we go, okay, breathing. How's their breathing? Do they need more oxygen, et cetera, and then move down the line. So by the time you get to the point where you're asking history of allergies, if the patient needs epinephrine, you've already given it. Okay. I believe in your book there is some talk about not being cautious about giving epinephrine to patients that have high blood pressure. This happens sometimes where there's some discrepancy, right? So we need to ask ourselves, what's more important? The patient having blood pressure problems or the patient not breathing? The patient not breathing is the bigger problem. So even if it means that their blood pressure is going to be even more elevated than it is normally, if we don't give the medication, they're not going to breathe. They don't have an airway. We need to administer it. Baseline set of vital signs. Vital signs in our order of operations for that assessment is after our ABCs, right? So we should be managing our ABCs first and then moving on to this secondary assessment with our vital signs and our history taking, all right? We talked about this. We can apply oxygen if the patient needs it. Administer epinephrine. Sometimes you might need to administer a second dose of epinephrine. That will be up to your local guidelines and your ability to administer it. Like, do you have a second EpiPen to give these patients? If the patient's not breathing, then we've got a different issue, right? We need to provide artificial ventilation. Their airway isn't open. They're not breathing. What's their circulation like? Within that, if you think it's an allergic reaction, you may administer epinephrine for it. You can certainly assist with an EpiPen auto-injector. There's plenty of people out there that have them prescribed that have never used them, and they might be kind of nervous about doing it. So we certainly can assist them with that. Yeah, and then I talked about the rest of that. I was just double checking. I didn't want to miss something. After using an auto-injector, the patient should be transported to the hospital, and we should be reassessing them almost continuously, making sure that they don't need more epinephrine and that their airway is staying intact. If they meet the criteria for epinephrine, but it's not prescribed to them and you don't have it, certainly we should be calling for additional resources so that the patient can be taken care of. So as a medication, epinephrine constricts blood vessels and bronchodilates. So I won't get into the chemistry of it all. We do that a little bit more in EMT2. We talk about why it constricts the blood vessels and dilates the bronchioles. But when we're talking about allergic reactions rapidly dilate blood vessels and constrict the bronchioles. So epinephrine is a perfect medication to give in those situations because it has the opposite effect. It constricts the blood vessels and dilates the bronchioles. So it helps bring that body back to homeostasis. It's often prescribed to patients that do have a history of severe allergies, and oftentimes it will be on the patient or kept at home on the refrigerator. Should hopefully be on the patients if they're out and about. Big thing is to make sure that it is for that particular patient. It's not expired. You go through those 5 rights. They do come in adult and children's sizes. So the children's size, it does say children's on it. I know this picture is kind of hard to read, but the EpiPen Juniors are green, and then the adult Epis are yellow. And there is a difference in dose and concentration between the two, right? Cutoff for this is 8. So EpiPens typically are not prescribed. EpiPen Juniors are not prescribed older than 8 years old. That's when they go to the adult dose. That being said, I know several people that have severe allergies that they have never had an EpiPen Junior prescribed. Even when they were, little kids, they had the adult dose. So if that's all you got, it will work. So we should be checking the expiration date. There is a little window on there to make sure that it is clear fluid that you're injecting. If there's any sort of like, if it's brown or if it's got like floaters in it, you shouldn't be injecting it. These are very heat sensitive. So if they like kept it in their car during the last, couple weeks that we've been having, it's possible that the medication has gone bad. We will play around with auto injectors in class, or I shouldn't say play around. We will learn about auto injectors in class. And we may have a real auto injector that the liquid is like brown. So it'll be kind of cool to show you that. We want to remove the caps and press firmly against the outer knee with the injector between the waist and the knee. So usually it's about mid thigh. We want to make sure that we're not injecting through like keys or phones or anything like that. So if they do have something in their pockets, we always want to try and shift that off to the side. You can inject through fabric. So if they've got jeans on, you can inject through that. Even like I know Duluth Trading Company has like fire hose jeans that are like really tough. You can inject through that. Big thing is if they're wearing multiple layers, like I'm not talking like boxers and jeans, like those are both really thin. But if they've got like jeans or base layer jeans and a Carhartt, camping or hunting gear. If you can remove the fabric and then go through it, it's fine. That would be preferred. If you have to go through it, just make sure that you're pressing really firmly so that the fabric compresses down and it goes through it. There's plenty of force to go through the fabric. Just maybe not height. We want to reassess after 2 minutes. Pulse will likely go up, but the symptoms will likely decrease, and it's usually pretty immediate that those symptoms decrease. So here it is. It is dangerous for patients that have a heart condition or are hypertensive. Yes, that is absolutely 100% true. But if the patient's not breathing or can't breathe, or they're losing an airway, we're really willing to risk it, basically. All right. Just follow your local protocols. So these patients may be uncomfortable or afraid to use it. That's when we can assist. The other thing, and I'll show you this technique as well. If people have had it before, maybe so there's two different types of patients in these situations, right? There's the patients that are like, oh my gosh, I need it right now, like do it. And it's super quick, simple, you can do it. And then there's other patients that are like, oh my God, like, I don't know if I need this yet, and I don't want to do it myself. I'm afraid of needles. I can't do it. Those types of patients. Sorry, I just clicked and I lost my slide. Oh, there we go. Those patients, I like to kind of hold their knee so that they don't like jump away from you when you go to administer it. Carefully monitor the patient's airway. Transport if you're capable of transporting. If their condition deteriorates, you can give additional doses for it as well. You may need to get online medical direction for additional doses. It'll just depend on how your protocols are written. So EMR administered epinephrine. So those EpiPens are several $100s. They're very expensive. They do expire pretty quickly. I want to say it's like 6 months to a year, something like that. They're pretty expensive. We can get 1 ml bottles of epinephrine. It's called Draw Up epinephrine, or Adrenaline is like the brand name. You can get 25 of them for like $5. So we have been approved through the state of Wisconsin all the way down to the EMR level to draw up that medication and then administer it. It does take a little bit more time, but it's so much better for the services that are having to supply this, right? Your dose is the same, 0.3 mLs for adults, 1.5 for children, and it's intramuscular, so you got to make sure you're using the right needles and then inject it into the muscle. There are certain kits that some services have where it's like all right together, all of the medication that you need. Others, it'll be separate. You'll have the medication in one spot and then all of the administration tools in another. Just know your service and get comfortable using the equipment that they have. Bottom line, regardless of what equipment that they have, you need to be trained on that equipment and understand how to use it. Okay. And that was the end of this chapter. Another kind of quick one tonight. I lost you guys, so I can't stop the video. Oh no. It's fun you got to experience what Mallory is like after 10 p.m. Goofy is the answer. All right, here it is.